let's turn to White House Senior Advisor Valerie Jarrett, who's been good enough to join us from outside the White House. Thank you again for that.
My pleasure. Good evening, Keith. How are you?
I have some specific questions, and I have a general question. The president left the overall intent of this for last. There were a lot of intriguing specifics and a lot of things that will sell well, and there were extraordinary moments in the speech. But the emphasis of this, the goal of this, if he'd had to boil it down to a sentence, was this is a moral imperative?
I think that's exactly what he says. He says it was something about the character of our country that makes it so important for us to deliver on behalf of the American people right now. For those who have insurance, they need additional safety and security and stability in the system. For those who don't, they need affordable health care, and we have to reduce the costs for everybody. It's a very simple, succinct message, and I think any American out there who is listening tonight knows where the president stands. And I also think that by the nearly 30 standing ovations he received from Congress, we have a good sense of momentum there as well.
On the subject of the public option, which the president wants to pin as about 10 or 15% of the reform here, it is contained, as I understood it from what he said, and I will not say that I'm automatically right because I'm reading the president's speech. His words may mean something else. Correct me if I'm mistaken. But I gathered that the insurance exchange, which would contain the essence of the public option, would not take place for 4 years. Is there a trigger system involved in this? Is there a phase-in, or is there flexibility on that point? What are the specifics you can tell us about that?
Well, sure, of course it's open. I think what he said tonight was also he's interested in other ideas. His plan is let's take 4 years and make sure we put it in place and get it right, but that we have a safety net suggested originally by Senator McCain in the meantime.
And that safety net, anything more specific about that, or is that being built as we speak? Because it seems that's a new concept, or at least a new, as you said, Senator McCain campaigned to some degree on it, but it's a new component or essential component to this final version of what the president wants, is it not?
It is new, and I think that what it shows is that the president has been listening over the months, just as he said he would from the outside. He's received a lot of terrific ideas from Democrats, Republicans, everyone across the aisle, and what he tried to do this evening was incorporate the best of what he's heard, and he considers that to be a good alternative until we can get the exchange up and running.
And the idea of that interim solution, that emergency care, would be to specifically focused on people who were threatened with bankruptcy because of the sudden onslaught of insurance and health expenses, or is it wider than that?
It's wider than that. It's people who currently don't have coverage, and there are many, many Americans, millions, who cannot afford coverage right now. And so if you lose your job or for whatever reason you don't have the coverage and you are in dire straits, you should be able to have a safety net. I think, Keith, what he was talking about, going back to the character, is the importance in our country to make sure that we're taking care of our citizens. When you're sick, you should not have to worry about going bankrupt and pay for your health care. And so until we have an exchange up and running, he'd like to have the safety net in place. And there were lots of great ideas that he received in the course of this process that we've been going through. And I think that he also said quite clearly 80%. There's an agreement on 80% across the aisle. And so let's focus on just closing this out once and for all. Let's this be the time that we deliver on behalf of the American people.
Is there, I think no one would ever look at the president's attempts for bipartisanship on this as anything less than sincere and admirable. Is there, even in the context of what he was able to achieve and address tonight, is there something over-prioritized about that if, when he says, look, this is a lie, there are no death panels, and he says, look, there is not going to be coverage provided for illegal aliens or people who are in this country illegally, and someone who turns out to be Congressman Wilson of South Carolina shouts from the safety of the crowd, that's a lie. Is bipartisanship feasible when there is this kind of almost blind reaction from the other side?
I believe there is. I believe there is, and I believe with a president such as President Barack Obama, we can certainly achieve that kind of bipartisan support. And the fact that he was able to take an idea that came from his opponent, Senator McCain, and incorporate it is a very simple gesture and a way of showing what his character is all about. And so I think the measure of a person is whether or not they continue to reach out, they continue to listen, and Keith, most importantly, He's focusing on what's best for the American people, and he's going to debunk anything that he hears that's nonsense, because the times are too important. There are too many people who each and every day are losing their health insurance. They're losing their jobs, and they're having to choose between paying rent, sending their kids to college, and paying their medical expenses. And in this country, a country as great as our country, we deserve better than that. And so I think his call tonight was a call to appeal to the better in all of us, that stop all this nonsense, stop all this terrible rhetoric, and remember who elected you and who sent you to Congress. The people of this country did.
To that point, last question, something very important. When the president said he will call people out who continue to spread lies about health reform, no matter where they come from, did he mean that literally? Will he be standing there reading a list of the people who are spreading this stuff the way so many others have had to do in the last 6 weeks?
Well, I think that we'll see that the president is a man of his word. I think what he's saying very clearly is that let's stop scaring the American people, particularly our seniors. Let's not do that. They don't deserve that. Let's have an honest debate about the issues. There may be differences of opinion on substance, and he said he welcomes new and exciting ideas, but let's just not try to scare people to keep the status quo, because what everyone has heard around this country is that the status quo is no longer acceptable, and he intends to move our country forward.
Well, I hope he does the calling out, because all of us calling out at the same time perhaps will get the job done. Valerie Jarrett, the senior White House advisor.
Thank you, Keith. And we know we can always count on you to call people out, so thank you.
I appreciate the way that was phrased. Thank you kindly.
Take care.